With that, I'd like to introduce Marc Gourevitch, Planning Committee Chair, who will present an overview of the agenda and a practical tool that we will be using and working on during today's event. Again, thank you for coming, and I'll turn it over to Marc.
Good morning, everyone. Good morning. Thank you, Sani, and for your and Josh Sharfstein, really great leadership of the roundtable. It's a pleasure to be here with you this morning. And what I'm going to try to do is to help explain the arc of today's conversation a little bit. So we have developed this simple diagram that you see. Actually, there are two simple diagrams, and I think there's another slide that is an even simpler diagram. That's it. So this gets at the arc of today's conversation. Along the left is a sort of downstream, midstream, upstream continuum, with the caveat that depending on one's perspective, whether you're a health system or, let's say, a community-based organization, an action like screening or referral might be viewed as downstream or midstream. So you have to really, throughout the day, allow some elasticity in some of these buckets. As one moves from the left to the right along the top, the role of the particular sector shifts. Healthcare, for example, is more likely to be a leader in a downstream effort, and by contrast, assume more of a supportive, collaborative role in a more upstream-focused effort that might be led, for example, by a social services agency. So today's workshop attempts to span this spectrum and showcases examples really from across it, including ones featuring different types of entities in the lead role, for example, public health agency, a health system, and a human services agency. While this is a small sample of the work taking place across the country, we aim to be illustrative of and to clarify the continuum of innovative work in this space. In addition to exploring partnership between health systems and other kinds of organizations, the agenda today also includes a conversation about the governance, leadership, and institutional infrastructure that are needed to help health systems work with communities and other partners to address health and the non-health needs of their patients and communities. There's a second diagram to which I'd also like to draw your attention. Perfect. Thank you. This is in the handout that you picked up at the registration table, and it should be in your electronic packet as well. And it is a map, essentially, of some of the lead conceptual models that look to situate healthcare's contribution to population health on this down mid-upstream spectrum. It references a number of important recent publications on this, like work from John Auerbach, from Alderwick and Gottlieb, as was already mentioned, Castrucci and Auerbach, and Kindig and Isham, and aims to portray commonalities and highlight differences in language and framing, really in an attempt to help us all have shared points of reference in conversations on this topic, and to put them on a single page. As one moves from the bottom to the top, attention shifts from downstream to midstream to upstream. Positioned from left to right are various models or frameworks that address healthcare's contributions along the spectrum, from identifying and addressing individual social risk factors to tackling more upstream social determinants of health directly, like, for example, through policy change. The diagram aims to capture a range of stakeholder perspectives, not just that of the healthcare delivery sector. So as you listen to our speakers today and engage in conversation, refer back to this both mentally and actually on paper throughout the day. Annotate it, scribble, doodle, question it, and I think that'll make for a better and quicker move into our discussion group later on this afternoon. So with that sort of framing for the arc of the day, we'd like to turn to our keynote presentations. I'll just say one more thing about the arc of the day. Essentially, you'll see the panels downstream, midstream, upstream. First we'll have the opening discussion, and then the discussion about infrastructure and organization, and then three successive panels that move across this spectrum that we showed in the first slide. So you will hopefully be able to follow that thematically as the day evolves. I'd like to introduce our two keynote speakers who will help us get situated. Laura Gottlieb is Associate Professor of Family and Community Medicine and Director of the Social Interventions Research and Evaluation Network, SIREN, at the University of California, San Francisco. She'll be joining us today via teleconferencing. It is early where she is. Benjamin Money is Deputy Secretary for Health Services for the great state of North Carolina, and will follow Dr. Gottlieb.